for his very hard work on the bill that we have introduced today, after being on the floor with me this afternoon to briefly discuss it. And I also want to thank his staff and my staff for putting in an enormous amount of time on this bill over the last several months. Mr. President, most Americans understand that our healthcare system is broken. We are spending nearly $13,000 a year per capita on healthcare. That's an astronomical sum of money, almost twice as much as most other countries. And yet, despite all of that spending, some 85 million Americans are uninsured or underinsured, and there are estimates out there, believe it or not, that some 60,000 Americans die each year because they do not receive the health care they need when they need it. And our life expectancy as a nation is actually in decline, despite all of that spending. Frankly, as broken as our general health care system is, our primary health care system is in even worse shape. As everyone knows, I don't think there's any debate on this, we face a major shortage of doctors, nurses, mental health professionals, dentists, and those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. According to the most recent estimates that I have seen, over the next decade, our country faces a shortage of over 120,000 doctors, including a huge number of primary care physicians. The nursing shortage may be even worse. Over the next 2 years alone, it is estimated that we will need more than 200,000 nurses. And despite the very serious mental health crisis we face, we're facing a massive shortage of mental health providers, psychiatrists, psychologists, social workers, etc. Now, that is not the point that Bernie Sanders is making or Senator Marshall has made. This is the point of view of virtually every major medical organization in the country. And on this matter, let me quote from a recent Washington Post op-ed by Elizabeth Rosenthal, a contributing editor at Kaiser Family Foundation Health News. This is what she writes, quote, and I hope our colleagues hear this, quote, American physicians have been abandoning traditional primary care practice, internal and family medicine in large numbers. Those who remain are working fewer hours, and fewer medical students are choosing a field that once attracted some of the best and brightest because of its diagnostic challenges and the emotional gratification of deep relationships with patients. The percentage of U.S. doctors in adult primary care has been declining for years and is now about 25%, a tipping point beyond which many Americans won't be able to find a family doctor at all. Already, she writes, more than 100 million Americans don't have usual access to a primary care doctor, a number that has nearly doubled since 2014. I ask unanimous consent to enter the full article into the record.
Without objection.
Now, what this article points out is certainly not news to the people in America. In Vermont and all over this country, our people often have to wait months in order to get an appointment with a doctor, and in some cases, they have to travel very long distances to get the health care they need. And let us be clear, there is no debate upon this. Some people think, well, we don't have to act on it now. Let's do it next year, following year. Wrong. The crisis is only going to get worse, and every day that we delay it, it becomes even worse. Now, why is this happening? Well, there are a lot of reasons why. But one of the reasons is that it turns out that the United States, despite all of our spending on health care, spends about half of what other nations do on primary health care. We spend approximately 7%. Most other countries spend at least twice as much. And the absurdity of that situation is that everybody knows that, quote, an ounce of prevention is worth more than a pound of cure, end quote. And if there's anything that Senator Marshall and I are talking about, that is exactly what we're talking about. If you spend money, you are spending money to save money. Keeping people healthy saves money. In other words, common sense tells us that if we can prevent disease, do a better job keeping our young people healthy, if people can access the medical care when they need it, not when they are just very, very sick, if we can do those things, we can keep them out of the hospital, and hospital costs are just extremely, extremely high. Common sense also tells us that it is literally insane that millions of Americans with non-emergency health care needs get their primary care in a hospital emergency room, which in some cases is 10 times more than the care provided them in a community health center. Let me just give you one other example of the irrationalities of our current system. In my own small state of Vermont, last year, our major hospitals spent $125 million in 1 year on traveling nurses because we don't have enough local nurses to support the needs of the hospital and many other facilities in Vermont. Meanwhile, young people want to become nurses. They're applying to nursing school, but the nursing schools don't have the faculty to educate them. I recently talked to a senator who told me that in her state, some 1,100 young people were applying for a space in nursing school. The school can only provide 80 openings. So we have a nursing crisis. We're not addressing it. Hospitals are spending 3-4 times as much money on traveling nurses as they are on homegrown nurses because we're not educating our young people at nursing schools. This may make sense to somebody. It does not make great sense to me. Mr. President, the legislation that Senator Marshall and I have introduced today does not solve by any means all of the health care crises we face. But if this legislation is passed, it will not only save us substantial sums of money, not only provide a medical home for millions more Americans, not only significantly increase the number of doctors and nurses that we desperately need, but it will go a long way toward transforming primary health care in America, something that is so long overdue. And with that, I want to turn the floor over to Senator Marshall. And I would say this, that Senator Marshall has a unique perspective on this. Not only is he a senator from a rural state, he is also a practicing physician and has an insight into the crises in health care that many of us don't. So with that, Senator Marshall, thank you very much for being with us.
Well, thank you, Senator Sanders. It's certainly an honor to be on the floor with you and with the President. Thank you so much, Mr. President, for sharing this moment with us. You know, one of my mentors here on the Hill has a saying that some senators come here to make a point and others come to make a difference. The first time Senator Sanders and I sat down together, he said, "Roger, do you want to make a difference?" We have worked so hard on this issue together, developing rapport, confidence in each other, in our staff. They've all done an incredible job as we try to get through this riddle of healthcare challenges across this great nation. I think as both of us travel back to our home states of Vermont and Kansas, what we found is not everybody has meaningful, affordable access to primary care. So we went out and tried to find the best actors. Where were the best outcomes? Who was making a dent? And I think we both discovered that our community health centers were doing a great job. They'd taken many pilot programs and they were improving them. I'm not sure what Senator Sanders would talk about some of his, but what I saw is this meeting patients where they are concept, integrating all the different elements of primary care, not just your blood pressure, not just your AccuCheck, but also your mental health, dental needs as well, are just a few more things that we're seeing being integrated into the community health centers. Nutrition coaching, something that's seldom been done in clinics before. So I think we saw these community health centers as doing a great job, and we asked each other, how can we improve upon them? And Senator Sanders and I agreed on this lofty goal that we could get more Americans into these clinics, and that was a great solution for primary care. So for the past 3 months, we've had a very thoughtful approach to this problem. And even before then, our committee has had multiple hearings with different folks as they've tried to address the problem as well. And then we've had multiple Zooms and meetings with folks back home. How do we solve this primary care problem? And again, this mental health epidemic just slapping us in the face every time we go back. And certainly, I think most of our committee would agree that the community health centers are a great solution, but they need to be bolstered and need to continue that mission across this great nation. So I'm proud of the work that we've done on the community health centers in this legislation. Again, thoughtful legislation, and our goal is to make sure that it doesn't cost the American taxpayer any more. Again, the Senator Sanders and I have both said many times this country is spending plenty of money on health care, but maybe we need to refocus a little bit more of it to primary care. So that's what we've done with this legislation, again, with a thoughtful approach. And our goal, again, is to make sure that it's all paid for and it doesn't cost the American taxpayer anymore. I think the other big issue that we found in common with folks back home is a nursing shortage and a primary care doctor shortage. If there's one thing that this bill would do, it would turn around the nursing crisis in a matter of just 3 years. My own wife is a community college graduate nurse. 90% of the nurses in our hospitals in Kansas, especially the rural hospitals, are 2-year community college graduates. So what we've done with this legislation is bolster more money for nursing programs. And the other program, like Senator Sanders said, the other challenge is colleges cannot afford the faculty, the nursing faculty. So we have some money to help bolster that program up as well. We have young men and women standing in line for incredible jobs in healthcare, but we don't have the faculty to bring them in. So we help with scholarships, we help with the faculty. That alone will change the dynamics across America if we have more nurses who are just the glue to this healthcare system. And then the next challenge that we attack here is just a shortage of primary care doctors in so many ways as well. So the legislation addresses that. It's great steps forward. I've been very proud, again, to work with Senator Sanders and his team, finding common ground, and I think we've made incredible strides. Senator Sanders and I have talked many times about our community health centers, and I might just ask him about the successes that you're seeing in your community health centers are, and what's your vision going forward that it looks like.
Well, thank you, Senator Marshall.
Senator from Vermont.
This is an issue I have worked on really since I've been in Congress. And one of the results of that, working with others, is that in my state of Vermont, I think we are leading the nation in terms of the number of people per capita who participate in the community health center program. Senator Marshall, my understanding is that in Vermont, 1 out of 3 Vermonters get their primary health care or dental care at a community health center. And one of the things that I love about community health centers is that they really are community health centers. In Vermont, they're not just for low-income people, as important as that is. They are for everybody in the community. We used to have a Supreme Court Justice of the United States of America who vacationed in Vermont. Guess where he went? To a community health center. My understanding is the governor of the state of Vermont gets his primary health care at a community health center. And that's what I love about them. And as you well know, and as you mentioned, what they do is not only provide primary health care, many of them provide dental care, which is a huge issue. Many of them provide the mental health counseling, which, as you indicated, we have a major crisis in. And they also provide lower-cost prescription drugs. So what they say is that regardless of your income, you got Medicare, come on in. You got Medicaid, come on in. You got private insurance, fine. You got no health insurance, we're going to work on a sliding scale. So by expanding these community health centers all over America, we're going to provide millions of people the opportunity to get the health care they need. That is what exists in Vermont right now, and we want to see that expanded all over the country.
Mr. President.
Senator from Kansas.
Senator Sanders and I have discussed this vision of what primary care looks like in the future, making sure that we're meeting patients where they are. Some of our community health centers back home are bringing in food bank. They're bringing in WIC programs, social services, able to do basic mammography in those units as well. We lose track of the patients is when we got to have to say, look, come back in a month for your mammogram. Instead, it's such a great thing to say, let's get it done today. But one of the biggest underserved areas of medicine is dental. And I know this is one of Senator Sanders' visions specifically in this legislation, is to address the dental crisis. As an obstetrician myself, the only known cause of preterm labor is poor dental health, caries, cavities, whatever you want to call it. That's but one. There's lots of links to having cavities and poor gum health to having heart attacks as well. It's a way under-recognized challenge for primary care. I can't tell you how many times I've been called at 10 o'clock at night, 2 o'clock in the morning on a Saturday with one of my OB patients that's obviously very pregnant, but she has a cavity. Now it's turned into an abscess, and I can't get her into a dentist. And I'm calling all my buddies, and again, it's Saturday, it's 10 p.m., all my buddies, the dentists are gone. So Senator Sanders, maybe you would just share a little bit about your vision on dental and how this bill impacts that.
Senator Marshall, thank you very much.
From Vermont.
Thank you very much for raising the issue of the dental crisis in America. I can tell you that in Vermont, we have a crisis. We have made progress, but we have a serious problem. The cost of dental care is very, very high. Southern part of my state, Bennington County, if you are a poor child, you're probably on Medicaid, you probably can't find a dentist. So what we have done in this bill is put $3 billion just one time, into capital improvements for community health centers. That's long overdue, because if you want to expand community health centers, they need money for their own expansion and infrastructure. Building a dental operatory, and that is the dental chairs and the equipment good equipment that dentists need, is a very expensive proposition. So by putting $3 billion into capital improvements, much of which I suspect will be going to those dental operatories, we're going to be able to provide communities all over this country with the ability to access dental care in a way they are not doing it today.
Mr. President, just want to continue this discussion of what our vision is for these primary care community health centers. I think that we all realize we have an obesity epidemic in this country too, a type 2 diabetic epidemic in this country that we need to address on the front end. And I'm so happy to see some of my community health centers coming in. They're doing nutrition classes. They're doing cooking classes. I think so many folks of our current generation maybe learned how to do some cooking. The fast foods were a little bit too easy. So I think it's that out-of-the-box thinking, these different programs, and I would call it coaching. We need to be coaching folks up and teaching them, but also give them the opportunity. So whether we're on the Ag Committee and working on food programs, we're trying to bring all these pieces together in the program as well. And I know Senator Sanders is also certainly committed to helping us address. He's been a leader, in this issue of trying to take care of folks with diabetes as well.
Let me just say, Mr. President, Senator Marshall has raised this issue from almost the first time we sat down and seriously discussed it. If we're going to talk about prevention, we've got to talk about obesity, among other things, because we're looking at a major, you tell me if I'm wrong, doctor, we're looking at a major diabetic epidemic in this country. And that is not only going to cause massive amounts of suffering, it is also going to be a very expensive health care bill. And certainly one of many of the contributing factors is obesity. So what Senator Marshall has talked about from the very beginning, we have to do a better job in nutrition education. And community health centers are very well situated to be able to do that. And at Senator Marshall's insistence, and I was delighted to work with him, we have language in here that will make it easier for community health centers to work on nutrition programs in a variety of ways with their clients.
Mr. President, I might just close with a couple thoughts. Again, we came in with the lofty expectations that we could make a difference in primary care for people across the nation, and I think our bill accomplishes just that. And again, I can't thank the staff enough for their support through this. Senator Sanders and I spent most of the August recess, and our staff spent every moment of every hour of every day on this August recess working on this legislation. I think it's a good product. I think there's always opportunity for improvement, and we're welcome to those ideas. I appreciate the senator using traditional hide protections at the appropriate places, so we've maintained that, which is important to many folks, including to myself. So I think we've addressed primary care issues. I think that we have a plan to increase nursing workforce. Again, in 3 years' time, we can turn that problem around and long-term address some of the primary care issues, addressing dental as well. I think it's going to be a huge improvement. And at the end of the day, you cannot overestimate how much money this will save programs like Medicare and Medicaid and health insurance back home and help drive the cost of health care down for people. I'm glad to see us try to emphasize maybe some better ways to spend the American taxpayer monies. But most importantly to me, the physician is just, this is the right thing to do. This is absolutely the right thing to do. It's a chance to improve the health of Americans, and I'm just proud to stand here beside Senator Sanders and introduce this legislation. Thank you.
Let me just thank Senator Marshall and his staff so much for their hard work. And to say, as he just said, we don't think that there are other ideas that could improve this, but we're open to new ideas. We hope to be intend to be marking up this bill next Thursday. Look forward to talking with all of the members on the Health, Education, Labor, and Pension Committee for doing what's really important. Senator Marshall started his remarks off by saying, I think, exactly the right thing. We can come here and we can all give great speeches. We can all talk about how next year we're going to get to something, or 5 years from now we're going to get to something. Everybody in America, in Vermont, Kansas, and all over this country understands we have a primary health care crisis. This is the greatest country on earth. We spend more money on health care than any other country. It is not asking too much that when you get sick, you're able to find a doctor, that you're able to find a dentist. It is not asking too much that when you're in a hospital, there are enough nurses there, that our young people who want to become nurses are able to get that education so they go out and get really good jobs. That's not too much. That's all that we are doing in this legislation. We are looking at the real world as it exists, and Senator Marshall, as a physician, understands that world quite well. We're looking at that world and we're saying, you know what? Let's not wait 5 years from now. We got a crisis today. Let's deal with it. And with that, Mr. President, I would yield the floor. Thank you.
Clerk will call the roll.
Ms. Baldwin.